the assistant professor at Madras Medical College from Department of Internal Medicine. And sir, thank you for coming back to Medicine, sir. As we had last session last month, a case presentation on aortic stenosis, and we are so grateful to have you back on our platform, sir.
Thank you, Nitish.
So you can proceed with your class.
Yeah. So, good evening, all. First of all, I would like to congratulate all the students who have appeared for your university examination. But some of you would have got low scores. Never mind. Okay. This is not the first or second step. This is very, very basic step you are entering into your life. Okay. University exam doesn't matter. Okay. However, the scores matters. You have to get into PG, then you have to get into super specialty. So many things you will be facing in your life. So don't think that you have got a very low score. Don't degrade yourself. Okay. Others have cleared. I have not cleared. Don't think that. Don't ever think of negative. Please be positive. Please stay positive. This is only just a kind of examination. That's all. This doesn't decide your destiny. That is what you need to understand. Okay. So here I will just share few tips how you are going to make up your exam within this short span of time. So because the NMC has given guidelines to conduct exam within 2 weeks, so probably you will be starting your exams by this month end, the theory exam. So how to prepare in this short span? So first is when you take the paper 1 of medicine, you'll be having essay question, short note, and MCQs. When you take MCQ part alone, I'll first elaborate how to prepare for this MCQ alone. Many of you belongs to our Dr. M.D Medical University. So what they have done is they have taken MCQs only from Davidson. Even I have checked. I have inquired my senior professors. So everybody has told that the MCQs were taken from our Davidson book. Okay. All the pages of Davidson will be having small boxes. All the boxes were converted into MCQs. So it is not so difficult to find all these MCQs from your textbook. So what I would suggest in this short span is you can get the help from others, or you can also sit yourself. You can just see the boxes and just note down the small 1 or 2 hints, whatever is odd in the tabular column. Okay. The second is when you have the PDF textbook of Davidson, you have sample MCQs attached only in the PDF. I don't know how many of you know this. When you have a hard copy Davidson, MCQs are not present in that book. But when you have the latest PDF of Davidson, you have some sample MCQs. So please try to solve that. They have given answers also at the back of the chapter. So that also you can try, because MCQs carries 20 percentage, that is 20 marks. So we cannot lightly take MCQs also. We know it's very short span, but still you can cope up with this short span with this type of preparation for MCQs. I don't think Marrow or other types of like prep ladder or Marrow MCQs will help for this university exam, because direct questions were taken from Davidson only. Okay, so I would suggest you to do that. So the second part is when you take the short note questions, there are 10 short note questions. If you read one topic, please prepare in a way that you read the etiology, you read the clinical features, you need common investigations and the treatment part for almost all the topics. For example, when I take this simple plural effusion as a short note. Please try to take etiology as one or two points. Clinical features. So common clinical features, when they have a left-sided plural effusion, you can start preparing like patient can have the pleuritic type of chest pain, patient can have breathlessness, patient can have sometimes hemoptysis, patient cannot lie down flat. So all these are common clinical features which will be coming for majority of the respiratory system. Like that, you can prepare the common clinical features for these selected topics. Coming on to the investigation, when you take respiratory system, it is only going to be the chest X-ray or the CT chest plane or a basic ultrasound chest. So this can be repeated for all the short note questions. And when you take CVS, it is going to be the ECG and echocardiogram, unless proven otherwise. So I would like to read in this topic, that is etiology, clinical features, investigations, and management. Management you can broadly read like IV antibiotics for infections. If it is going to be heart failure, you can read one or two drugs about the diuretics. If it is going to be the CNS infection, you please read about the steroids and IV antibiotics. So commonly you read so that if any kind of question is asked, you can write this common steps. So that will definitely fetch you at least 3 or 3.5 marks for out of 5. So this is regarding your short note questions. This is almost 50 percentage of marks. So please try to have small hints for this so that when you revise, it will be very useful. So when you write in your exam, at least you can cover this basic points what I discussed now. So etiology, clinical features, investigations, and treatment. So if you write in this order for all the questions, this will definitely fetch you good marks. If you don't know any questions, for example, it's coming very gray area or you have never heard about, but if you know that from which system it is coming, please write this common thing. At least please fill the page. Okay. Last is your essay question. I just saw the paper on your exam day itself. It was a very odd question, which is coming from poisoning. So this was not expected for a long question answer at MBBS level. But still, when you are going to prepare at present, you take last 5 year question paper of our MGR University. You can just note down at least like 10 to 15 essay questions topics alone. Just keep preparing whatever the topics I told just now for the short notes. The same subheadings you will get for even the essay question. The simple example what I would give is your myocardial infarction. So like 60 years male coming with left-sided chest pain, with sweating, with palpitation, with vomiting, like that history might be given. ECG shows ST elevation in lead 2-3 AVF. What would be your likely diagnosis? What is the etiology? What are the clinical features? How do you want to investigate further? And what management you are going to give to the patient? So this is just a framework of any question, just an example to share. So you just prepare the essay question of common topics which were asked in the last 5 years, at least 5 years. Just read in this headings so that it will be helpful when you write the short note also. Essay question will be framed majority like this so that the whole topic is covered. So two essay questions. If you don't know also, please write relevant common clinical features, common investigations and management without changing the question. Why am I specifically telling about don't change the question? For your exam, our professors they have gone for exam paper evaluation, few of them shared their own experience. What happened is the question was rat killer paste poison, but certain students have written as OPC poison heading. They have written as OPC poison and they have started writing the long essay question. So please don't do that. Even you don't get the grace marks also. So please don't change the question. Whatever they have asked, please write the same headings. And then if you don't know also, please don't write a wrong question. Write the same content and you can just write down all the common clinical features, common investigations, and few drugs which you remember to complete the essay question. Okay. So this is regarding your essay type of questions. If you know very well, never mind, you can write even 3 to 4 pages fully. But sometimes the same question, like if you don't know, please don't omit the question. Please don't change the question, but please write some common clinical features, investigations, and management, whatever I suggested you for the short notes. Okay, so this is regarding your paper one. When you go to paper two, the part B content will be having definitely questions from chest medicine, dermatology, and psychiatry. So thank you, Parthiban. I just saw your message now. Yes. When you take paper two will have psychiatry, dermatology, and your chest medicine. Definitely in paper 2 part B. So don't worry about the part A. If you do part B well, you will definitely score good marks in paper 2. So concentrate only mainly on the paper 1 topics. Okay. So that is going to be the majority problem what students are facing each and every day. So this would be the outline for your theory paper regarding paper 1 and paper 2. Even paper 2 also, majority questions were directly taken from your Davidson book, all the small boxes, whatever is given in your textbook. So this would be the common advice. Don't omit any questions. Please write the common format even if you don't know any questions also. If you know well, please write the full content in all the subtopics, whatever we have discussed. And regarding the essay question, please don't change the question format or the question content. Please write the heading, whatever they have asked in the question paper. So this is regarding your theory paper question, how to prepare in this 7 to 8 days of time. Now, few people, they have scored less marks in your practicals also. So how you can help in this practical exam? So you all know the pattern. The majority is going to be taken care by your long case and your OSCE along with your spotter. Okay, so previously spotters were very less marks, but now they are giving spotters also equal marks compared to the long case as well as your OSCE. So when you start preparing, please write the case sheet properly. My first ever class in CNS, the format is readily available in YouTube. You can just follow it for the order of presentation of history as well as examination by seeing that video if you are not sure. Okay. If you are sure enough that you know the order of presentation of your long case sheet, never mind, you can just follow that. So please learn to write the case sheet properly. Spend time, keep a stopwatch for 30 minutes and complete your case sheet writing. Why am I telling this is all the 10 days I have watched in our college also, Madras Medical College, students were not able to complete the case sheet within the stipulated time of 45 minutes. So the case sheet becomes improper. You don't get a good mark without a proper complete case sheet. So when case sheet is concerned, you have to start from the name, age, the informant, the chief complaints with the duration, and then history of presenting illness. What we observed in history of presenting illness is you will be having definitely a format of writing the case sheet. So in that, they would have given history of motor system, history of sensory system, history of posterior column, so many things. The headings should not be written in the case sheet. Please remember that you have to directly start from the chief complaints, continue with each subdivisions of the case sheet. Please don't specify that you are asking history of sensory system, history of posterior column, history of so and so. So like that, please don't try to do that mistake. And then you go with personal history, and then your past history, and then your treatment history, and then occupational history if it is relevant, and then you have to summarize whatever you have asked in the history. So that part also many of the students have forgotten to write. And then after the short summary specifying which system you are going to get involved, you go to the examination part, complete fully the examination, complete other system. This is one another thing they have forgotten. Many students have missed this part. So when you're taking CNS as long case, you need to write CVS, RS per abdomen as other system and complete the case sheet. So this has to be highlighted here. And finally, you're going to put the diagnosis, complete diagnosis, and then you're going to write the investigations, whatever is required for your case, and then the treatment. So this completes the case sheet of your long case. So this case sheet writing will carry at least 15, 10 to 15 percentage, that is 10 to 15 marks of the 40 marks. Okay. So I would suggest you to write, practice the case sheet for the majority systems, whatever is kept in your college. Mostly they prefer central nervous system as a long case for undergraduates. Very rarely they can keep cardiovascular system, maybe a valvular heart disease. Less likely a pleural effusion case or a bronchiectasis case can be kept as a long case. Per abdomen is very, very less for a long case. So prepare well as a short case for per abdomen and respiratory system. CVS and CNS, please be prepared for writing the long case sheet as per the protocol. Coming to the OSCE, you all would have been trained in OSCE. Definitely, OSCE is going to fetch you 40 marks. So please prepare the OSCE, whatever they have trained in your own college. Definitely one will be from your skills demonstration. Simple example is the demonstration of deep tendon reflexes of upper limb, demonstration of plantar response, demonstration of measurement of blood pressure, demonstration of pulse. So all these things can be kept for the skill demonstration. Few will be like lab interpretation. Few questions will be from like an ECG interpretation or image based question. So all these things you would have been trained in your own colleges, but this carries equal marks when you compare with the long case. So please put your own time in preparing this OSCE, because this is going to fetch you the maximum marks, which can be easily got. This is like a bonus points for your exam. Next is your spotter. Spotter mostly pallor, icterus, pedal edema, clubbing. Okay, you would have all experienced all these things in the previous exam. So one is going to be coming from the dermatology. From that also commonly psoriasis and tinea infection. Very rarely they are going to keep you Bell's palsy. So when you prepare all these things, at least you can score well in even in spotter also, because spotter is also four spotters. So that also has equal marks of your long case and OSCE. Okay. So like this, if you're going to prepare, you will definitely get more than 110 or 120 very easily. I'm not totaling the Viva here. So even without Viva, you can easily get at least 100 or 110 like that if you target all these three main topics: long case, OSCE, and spotter. So this is the majority part which is going to be in your practicals. And Viva, you will all be knowing that there is going to be only 4 stations with drugs, instruments, and then your logbook. One is going to be the recent advances, so that you will clear very easily Viva. The only part is OSCE, spotter, as well as long case. So long case, please write long case sheet, keep a timer, complete it within 30 minutes. That is going to be your practice. Prepare for OSCE, whatever they have trained for you, and prepare for the spotters. You can refer the Kundu textbook or even Archit Balur or Alagappan, whatever textbook you follow. Please read some 5 to 10 questions, whatever they have asked already in the spotter subdivision. So that is going to be very, very helpful for preparing this spotters. Okay. So time is short, but don't feel stressed up. This is just only an examination. Okay. This is not a destiny, or this is not going to be the future most part of your life. This is just a beginning step. So my kind advice is stay positive. Okay. Sleep well again. If you don't sleep well, whatever you read, you forget the next day itself. So please sleep at least 6 to 7 hours daily. At least, I'm telling at least. Okay, you all will be stressed up, but please spend time for your sleep. Have a good sleep. Okay. Prepare well. You will all definitely get good scores if you are going to like prepare whatever I would have suggested. But if you have any other better method, you can please follow that. This is only just an advice I'm giving you. Okay. So if you prepare in your own method also, never mind. But whatever I told as common topics, please try to stick on to that. Prepare some common clinical features, common investigation and treatment part. Whatever question you are getting relevant to the system, please write the common clinical features first, and then if you know additional points, you can add on to it. But if you don't know any question, please complete the answer sheet with whatever I have discussed now. That will definitely fetch you marks. Okay. So my kind wishes for everyone to get good score. Okay. As what is not expected. Right. So prepare well. Very, very best wishes for all you people. Okay. We'll once again meet with the next respiratory system topic. Okay.
Thank you so much, sir. So this was a very wonderful session, and I hope that this reaches a lot of students who are appearing for the supplementary exam, sir. Hope we meet again for the next session. Thank you, sir.
Yeah, sure, sure. I
Thank you, sir. We'll stop the recording.
have anyone asked any,
Sir?
have asked a question?
No, sir. Chat box లేదు వర్లేదు sir.
Okay, fine. No issues.
Okay. But we have had more than 100 plus views, sir.
Okay, ma, sure. Okay.
Thank you.
Thank you, pa.